Published their findings this week in a major medical journal. News 10's George Warren spoke with one of the study's authors.
UC Davis researchers are careful not to say too soon that they've definitely found a cause of autism, but they've certainly found a powerful link to certain antibodies found in the blood of women who gave birth to autistic children.
Yes, we are excited. I mean, we were really happy with this paper coming out.
The landmark research found that those antibodies introduced into pregnant rhesus monkeys resulted in the birth of babies with behavior that would be considered autistic in humans. And among all humans with autism, 23%, nearly 1 in 4, were born to mothers with those particular antibodies.
It's not a rule-out test, so even if you're negative for these, you could still have a child with autism. It's what we call a rule-in test. So the specificity is high enough that we think if you have them, that you will very likely have a child with autism.
So, what do we do with this information? New mothers who test positive for the antibodies would know that their child is likely to be autistic and they could seek early intervention. And women who haven't yet conceived could make an informed decision about having a child.
As exciting as it is to identify antibodies in a mother that appear to lead to autistic offspring, nobody yet knows how to prevent those antibodies from being formed or how to keep them from being passed to the child.
The final piece is eventually we're going to try to come up with a therapeutic, an intervention, sort of biologic intervention to be able to treat women who are positive, keep those antibodies from getting to the target, and potentially, being able to have a typically developing child.
Now, 1 in 88 American children is born with autism. There appear to be a number of causes, nearly all of them mysterious. That's why it's so exciting that nearly a quarter of those cases can be explained by certain antibodies in a mother's blood.
Well, now I guess that what we need to do is find out what's causing these antibodies. What are women being exposed to make these antibodies form in their body?
Years before the birth of their child, something happened to them to make them create these antibodies. If we could block that, or at the very least block it from being crossed across the placenta into the unborn child, we could solve perhaps a quarter of the cases, or prevent it.
Which is a lot, but do they know why it's just that quarter and not all of the cases?
Isn't that interesting?
That's
That's what's so strange about autism. But and it does leave, it's that half glass, that half full analogy that 75% now are still unexplained.
Yeah. But maybe not for long. We'll see. This is a major breakthrough.
Great work. All right.